What do you say to the American people who are confronting this new reality?
First of all, my heart goes out to those who have already lost someone or those who are suffering from the virus. And this is bigger than any one of us. This calls for a national rallying to everybody move together. And, I laid out in detail what I would do if were I president today. You can go to joebiden.com, and I laid it out in significant detail. But there are three pieces of this. First of all, I have to take care of those who, in fact, are exposed or likely to be exposed to the virus. And that means we have to do testing. We have to get the testing kits up and ready. I would have the World Health Organization. I'd take advantage of the test kits they have available to us. Even though the president says 1 million or more are coming, let's just get all the tests we can done as quickly as we can. Secondly, I would make sure that every state in the union had at least 10 places where they had drive-through testing arrangements. I would also, at this point, deal with the need to begin to plan for the need for additional hospital beds. We have that capacity in the Department of Defense as well as with the FEMA. And they can set up 100-bed, 500-bed hospitals in tents quickly. We have to lay all that out, but we have to deal with the economic fallout quickly. And that means making sure that people who, in fact, lose their job, don't get a paycheck, can't pay their mortgage, are able to pay it and pay them now. And do it now. Small businesses be able to borrow interest-free loans. And with all due respect to Medicare for all, you have a single-payer system in Italy. It doesn't work there. It has nothing to do with Medicare for all. That would not solve the problem at all. We can take care of that right now by making sure that no one has to pay for treatment, period, because of the crisis. No one has to pay for whatever drugs are needed, period, because of the crisis. No one has to pay for hospitalization because of the crisis, period. That is a national emergency, and that's how it's handled. It is not working in Italy right now, and they have a single-payer system. Now, with regard to what else I would do, the fact is that we're in a position where I would bring together the leading experts in the world. Instead of doing this in the United States, instead of doing this piecemeal, sit down and do what we did before with the Ebola crisis. What is needed? And have one voice, like we did every day we met in that crisis in the Situation Room, laying out, so we lay out overall for all the nation what the best proposal is and how to move forward. In the absence of that, governors are making some sound decisions. They're doing the best they can by going out and getting the healthcare experts in their communities and their states to move. But it should be directed from the White House, from the Situation Room, laying out in detail like we did in the Ebola crisis, and we beat it.
Thank you.